And turning it over to you, Senator Murray.
Well, thank you so much to all of you for joining me today to talk about this really important topic. And I specifically want to thank the King County Veterans Administration, SSVF, VA Puget Sound, and Sound Health who are joining us today. As I have said before, one of my most important jobs as a US Senator is making sure we are there for our veterans. My dad was a World War II veteran and a Purple Heart recipient, and help from the VA made a big difference for our family. In my time as a senior member of the Senate Committee on Veterans Affairs, I have met with countless veterans who have sacrificed so much for this country. I believe very strongly no one who served our country should have to wonder where they're spending the night or if they have a roof over their head. That's why I've been working for years to help ensure our veterans have safe, secure, affordable housing options. In the American Rescue Plan that Democrats passed last spring, I worked to secure billions of dollars for veterans services, $14.5 billion to support our 9.2 million enrolled veterans, including veterans who are already receiving VA housing support and veterans who are experiencing homelessness. And I look forward to hearing from all of you today about how the CARES Act funding and other funding streams have supported your work and what more we can do at the federal level. I want you all to know that securing funding for our veterans is a big priority for me every single year on the Senate Appropriations Committee, specifically getting more dollars to programs that will help to keep our veterans housed. Housing saves lives, plain and simple. And when it comes to our veterans, we have a serious obligation to meet. So count on me to be in your corner, fighting for every dollar I can to bring back to King County and working to cut any red tape that stands in the way. So I really appreciate everyone here today that's here to talk about the issue. And I'm going to turn it over to Evan to begin. Evan.
Yeah, hey everyone. Really excited to be here, and thanks to Senator Murray and your staff for once again taking the time to highlight veteran homelessness. Again, I'm Evan Brennan. I'm a program manager with Sound Health, a healthcare nonprofit here in Seattle, Washington. I work for the Supportive Services for Veteran Families program, or SSVF, and I'm also an active member of the King County Veterans Operational Leadership Team, which is a group made up of veteran service providers tasked with ending veteran homelessness in King County. We're here today to share a few updates and talk about the progress we're making towards ending veteran homelessness, especially in the last 18 months and throughout the COVID-19 pandemic. We're really excited to share that veteran homelessness is down nearly 50% from its peak in December 2020, thanks in large part to CARES Act funding, new initiatives locally, and recent national commitments by the Secretary of Veterans Affairs to permanently house 38,000 veterans across the country. We're committed to reaching those goals and moving this work forward. You're going to hear from several people today, many of whom have dedicated their entire careers to advocating for and working towards real solutions to ending veteran homelessness, including Senator Murray. It's important to pause and evaluate and even celebrate the progress that's been made, but we need to acknowledge that our work is not all done, and in many ways is even more challenging. We need increased funding, continued partnerships, key legislation, a data-informed approach, and we need to continue to build a system that works for all things that have allowed us to make the progress that we have today. In addition to hearing from leadership from VA, King County, and SSVF, we'll hear a bit later from a veteran, Mr. Kessen, who will share his story and his experiences working with our programs, as well as his case manager, Irmana, who's working alongside him. You'll hopefully hear an example of what happens when a system works, and we're hopeful this example will encourage other veterans to reach out and seek assistance. On that note, we want to truly encourage any veterans experiencing homelessness to reach out to get connected to services and housing resources that are available to them, because they are available to them. There will hopefully be numbers provided in today's call and press release for veterans locally to reach out. And now I'd like to introduce our great SSVF Regional Coordinator, Katie Morissette, who can speak more broadly about VA and SSVF's role in ending veteran homelessness throughout Washington State and locally here in King County. Katie?
Evan, thank you so much. And a huge thanks to you as well, Senator Murray and your whole team for organizing this call today and for your ongoing support of the crucial work that's being done right now to end veteran homelessness in Washington and in the rest of the country. As Evan said, my name is Katie Morissette, and I am the SSVF Regional Coordinator for the Pacific Northwest. So I oversee SSVF grant operations in Alaska, Washington, Idaho, Oregon, and Northern California. And I'm really excited about the work that's being done right now by all of our grantees. I'm really honored to be here today with all of these dedicated homeless service providers. Everyone on this call is working tirelessly, and that work is reflected in the significant reduction in homelessness among veterans in Washington state. With the influx of CARES funding over the last couple of years, SSVF has been able to provide emergency housing, food, case management, rental assistance, and other vital services to hundreds of veterans in Washington who would have otherwise been homeless were it not for this assistance. Everyone on this call is literally saving lives every day. With the recent expansion of shallow subsidy, we've extended our reach and are able to provide long-term rental assistance for veterans who just need an extra boost to find housing and maintain permanent independent housing. I really want to emphasize in all of my conversations that none of this work is possible without strong collaborations among VA Medical Center homeless programs, local and state government, and other community-based homeless service providers. This has truly, truly been and will continue to be a team effort. I'm so excited about the work that we've already done, and I'm looking forward to continuing towards our goal of eliminating veteran homelessness. Again, I want to extend my sincerest gratitude to you, Senator Murray, and to everybody else on this call for your work. With that, I will pass the mic over to Kara Franke, who's the Director of Community Housing and Outreach Services at the Puget Sound VA. Thank you again.
Good afternoon, everyone, and thanks so much for your time. Today at the VA Puget Sound homeless programs, we actually have about 136 staff members that provide clinical work and services to our homeless veterans in our catchment area. And VA Puget Sound serves veterans from the Canadian border all the way down to Olympia in Western Washington. Very large catchment area. We have staff that provide services ranging from connecting veterans to rapid rehousing programs, as well as to permanent supported housing programs and everything in between. We work very closely with our community partners in transitional housing and rapid rehousing programs such as Sound to coordinate services, both medical, mental health, and homeless, connecting with housing. And have utilized CARES funds and the ARP funds to assist us with that process. So examples are utilizing smartphones that we've distributed nearly 1,000 smartphones to our homeless veterans so that they can reach out to landlords, connect using virtual care with the VA and their case managers, and just be able to reach out to family members at a time when they're really isolated. So that's been one really valuable resource. Additionally, we've used funds to support the movement of veterans into hotels during the time when COVID was really at its height. Some of the congregate living facilities were risky for veterans with health risks or just inability to socially distance. So utilization of that funding has helped us to not only support veterans during this crisis, but also then to be able to have a place to reach out to them and coordinate housing with that as well. And additionally, we've purchased move-in kits, which has helped us to enable veterans to sustain housing once they have been placed in units. And then finally, the VA as a whole, as Evan mentioned, has started to work on a 38,000 veterans campaign. So nationwide, our goal is to house 38,000 veterans. And locally here at VA Puget Sound, our goal is 802 veterans to house. And so we are working very closely with our community partners and could not do the work we do without the community collaboration. So to speak a little bit more about our hotels and some of our medical services, I will pass it on to Dr. Simha Reddy.
Thank you, Kara, and thank you, Senator Murray and your staff for both your support and a chance to share a bit about our experience. So my name is Simha Reddy. I'm a primary care physician, and I serve as the medical director for VA Puget Sound's Homeless Veteran Primary Care Program. And I'll say these last 2 years have been very eye-opening for me. They really helped me realize how much is possible when you have all the tools you need. And I remember those first weeks in particular the pandemic being very difficult and terrifying. And I remember laying awake, worried, thinking about how this virus was about to tear through my veterans living in shelter, right? And I kept waiting for that shoe to drop. But in the meantime, help started arriving. And, as Sarah mentioned, with the supportive cares and other funding, we were able to move veterans out of these congregate shelters, for example, and into hotel rooms and other spaces. And the thing that was really remarkable, I think, was that in that fight to prevent the spread of COVID, we kept gaining new tools to fight homelessness. Right? And you mentioned housing saves lives. They are so intricately connected, right? Health and housing. So things like hotel rooms, cell phones, new transportation options. And so all of a sudden, I could go visit a struggling veteran. I could bring at a hotel room where he was safe and secure, bring him medicine, bring him a smartphone, connect him by video to a counselor, and have him like fully engaged in physical and mental health care, for the first time in a long while. And even more important than that, I think, was that our housing partners, the people you see on this call, really seemed to be on fire. They had the resources they needed to get people first to safety and then into housing of their own, at which time we were able to keep caring for them in terms of their medical issues. So I'll say, despite the difficulty of these last 2 years, it's been a joy to get to see veterans recover and heal more quickly when they've got the right supports. And I'm hopeful, I'm optimistic that we'll find a way to keep doing that and to keep doing it better. But I'd like to turn it over now to Megan Stanley with King County, one of our wonderful partners in this.
Thanks so much, Dr. Reddy. Good afternoon. Yeah, my name is Megan Stanley. I'm the Veterans Administrator for King County's Department of Community and Human Services. And first, thank you, Senator, for convening this really important conversation and the work that you do to support our veterans every day. And thanks to our partners from the VA and SSVF, not just for being here today, but being partners and showing up every day in this work to serve and stabilize veterans in our community. In my work at King County, I have been able to really see the value of the partnerships that we have with entities such as VA Puget Sound, SSVF agencies, other government entities, and really the vast amount of community partners we have who are constantly leveraging different resources and funding streams to help holistically serve our veterans, service members, and their families. For me, one of the best examples of just illuminating partnerships has been our collaborative case management, or CCM, program. We started this program just over a year ago in partnership with the VA, King County Veterans Program, and the King County Housing Authority. And this is a first in the nation pilot that we started. In this, we're able to allocate VASH housing vouchers to lower acuity veterans who normally wouldn't get these vouchers, while providing case management through the King County Veterans Program. And as a result of this, we've issued housing vouchers to over 100 veterans in the past year who otherwise wouldn't qualify for such resources and very likely may have remained in homelessness. Just in the first year of operation, CCM has really been a success in housing veterans and reducing veteran homelessness in our area due to all these agencies working together and providing different types of interventions with different types of resources, all at the same time in the background, hopefully seamlessly. It's really important for us to note also that this is made possible due to our community's continued support of our Veterans, Seniors, and Human Services Levy, which has really encouraged the creation of systems and teams to work together to serve different populations such as veterans. In our collaborative approach, KCVP is providing in-office case management and remained open all throughout the pandemic so that veterans could come in. Also providing service referrals and flexible financial assistance through our local levy dollars. While at the same time, SSVF partners have been able to provide interim emergency housing, as you've heard, through the federal funding streams to keep veterans out of street homelessness. And our partners at VA and the King County Housing Authority are providing that permanent housing solution through these VASH vouchers. So this model both immediately stabilizes veterans and is providing the long-term solution to help end the cycle of homelessness, and also offering ancillary supports to address things like employment, income, mental health counseling, and supports for veteran well-being. These partnerships show how we are able as a system to come together and utilize multiple funding streams and resources to ensure that a veteran's needs are met in a timely manner, while also reducing the barriers and the burdens on the veteran of seeking assistance from multiple agencies. Co-locating services has been really important for us, and I think that you'll hear about that later, that having services in one place where a veteran can show up and have all of their needs met has been really important in the pandemic and will be important into the future. So as a result of this and other efforts, we've seen a really great reduction, as Evan said, in veteran homelessness in the past 12 to 18 months during an unprecedented pandemic. But we know that our work together needs to continue to end veteran homelessness in our community and to provide resources that make King County an area where our veterans can thrive into the future. So Senator, I want to thank you again for convening this and for our partners. And now we're going to hear from a local veteran, Taryn Kessen, about his experience receiving services from these agencies.
Hi, first of all, I want to thank you for your time, ma'am. Excuse me if I get a little teary-eyed, but my whole process started through the Veterans Crisis Line. I left a domestic violence situation and I was homeless for a while. And through reaching through the Veterans Crisis Line, getting first in contact and then better contact with the VA, and then being introduced to people like Taryn Kessen and Miss Romana here right next to me has absolutely changed my life. I've heard, through other veterans about, their processes with the VA and their time and how, either, unsuccessful it may have been, but going through this now, these two people especially have helped me through one of the darkest times of my life. And I don't have the words to explain how grateful I am. And if there's anything I can do to, help make this program available to more people, like this is really needed. So, I'm just going to take this time to be grateful for everybody on the Zoom call who's made this possible for me. And, now finding out that you make this possible for hundreds and thousands of veterans where you guys are. So I just want to extend my gratitude to everybody participating in this, because it means a lot to a person like me who, I don't have very much, and it's been a very dark time for me. So I just want to say thank you.
Taryn, thank you so much for sharing your personal story. And it means so much to me to know that the resources that we provided through the CARES Act and through the American Rescue Plan meant people like you found the help they needed when they needed it. And you are just one of many. The successes that we've heard about in King County using these dollars to create new ways to help veterans get off the street and use and to coordinate with each other has made a difference in lives of people during a COVID pandemic that who would have thought. So I am very proud to do my part. I'm even more proud of all of you on the ground who've really taken this by the helm, used these funds in incredible ways and made a difference in people's lives, just like Taryn just described. I think we have to learn all the lessons that you have and continue this in the future, but I'm proud of what you've done and I'm really happy to be a part of it. So thank you for sharing that today.
Okay, and just quickly before we wrap, because there are some outlets on today's call with us, I want to put out and ask if there are any questions from the press. Just go ahead and unmute yourself, let us know your outlet. We have time for one or two. Okay, seeing none, because it is just TV desks, we'll turn it over to you, Senator Murray, to close us out.
Well, again, just thank you all so much for the work you're doing on the ground. I'm going to continue doing my part because I know I got great partners on the ground with all of you who make a difference in people's lives. Thank you. Thank you so much. Take care. Stay safe.
Thank you, folks. That concludes today's press call.